The problem that we're facing globally is a huge increase in sexually transmitted infections. In the US, for example, the CDC have recently released data to show that STIs, or sexually transmitted infections, have increased for the 6th year in a row and are currently at record levels. So, for instance, gonorrhea, which is one of the sexually transmitted infections, has increased 56% since 2015.
Diagnostics right now are too slow for clinicians to guide their treatment with the patient still in the clinic in the first visit.
In the United States, typically what would happen is a patient would come to a clinic and undergo a physical exam, and then diagnostic tests would be collected. The results would come back anywhere between 2 and 7 days later.
So we developed the PROMPT platform, which stands for Portable, Rapid, On-Cartridge Magnetofluidic Purification and Testing. This platform was created using magnetofluidic technology developed in Professor Jeff Wong's lab at Johns Hopkins University. This platform allows for low-cost, portable, and rapid results in just 15 minutes to diagnose gonorrhea and tell if it's susceptible or resistant to ciprofloxacin.
In the US context, the majority, so 65% or so of patients with gonorrhea would respond to a single oral medication without the need for injectable antibiotics. Then you can see how a test that diagnoses infection but also provides information on antibiotic sensitivity is extremely valuable.
We couple sample preparation to highly sensitive PCR assays using magnetofluidic cartridges, which use the transfer of magnetic particles to automate the purification of DNA and couple it directly to the nucleic acid amplification test. We wanted to maintain the same sensitivity and specificity that's currently used in the clinic, but reduce the time.
I've worked for many years in sub-Saharan Africa, and the approach there is one based on clinical syndromes. So a patient will come to the clinic, they'll describe what their problem is, and then the clinician will examine them and then make a diagnosis based on what they see.
We've demonstrated that we can bring this to Uganda and use this in these low-resource settings with this portable instrument to give people the care they need when they need it. The real novelty here is our magnetofluidic cartridge. It uses common plastics, polypropylene, acrylic, that have been laser cut and thermoformed, and can be made at a highly scalable manner, more so than what's currently on the market, which require many moving parts. In addition, this technology could easily be converted to any infectious disease. As we've seen in the pandemic here, across the world, there have been severe deficiencies in rapid diagnostics and accessible diagnostics. We really want diagnostics to be accessible to everyone.
The technology that is harnessed here is amazingly exciting. It allows clinicians to diagnose the person and to offer treatment in real time.
We see the PROMPT platform as a really universal testing platform that could extend to enable accessible diagnostics to people throughout the world.